These heated and extreme rhetorics, not necessarily been confined to Congress recently. A column in the LA Times causing some controversy as well. Columnist Michael Hiltzik, referring to the unvaccinated who have died, wrote, "It may be not a little ghoulish to celebrate or exult in the deaths of vaccine opponents, but mockery is not necessarily the wrong reaction." Dr. Ron Elfenbein, emergency room physician and owner of FirstCall Medical Center, joins us now. So, Doc, the LA Times took a lot of heat for this. You've treated a lot of COVID patients. What's your take on this? I'm guessing you're hearing whispers of this, at least. This guy just said it out loud.
Yeah, you're right. Unfortunately, we are hearing whispers of this. And I mean, I don't even know what to say. I mean, I think there's no offense to you. This certainly isn't intended towards you, but there's a reason why the media in general is ranked below used car salesmen in terms of national, polling on who people trust and who people turn to. I mean, it's absolutely disgusting. And I would say this person should be ashamed of himself, but I guarantee you he's not. So it's absolutely disgusting and appalling that somebody would say something like that. I mean, do you blame a fat person for getting a heart attack or a stroke because they're overweight? I mean, are you going to laugh at them because they are in the emergency room clutching their chest? I mean, it's disgusting. Well, absolutely disgusting.
The thing is, Doctor, we know that those who choose not to get the shot know the risks. And the ones who are primarily hospitalized and dying are the unvaccinated. And I think it's okay to say that out loud.
To say that what you just said, that yeah, absolutely. Yeah. It's okay to say that out loud. But to make fun of somebody for dying and for, making a choice, a medical choice, again, you could say the same thing about somebody who is overweight. They made a choice to continue to eat and be overweight. I mean, I'm not suggesting that everybody who's overweight is just because that they can't stop eating, but you just have to have some empathy for people. It's not, they didn't choose to die. They didn't choose to have this happen to them. They made a choice for whatever reason, and it's none of my business or your business why they chose not to get vaccinated, but they chose not to get vaccinated. So, at the end of the day, if they're succumbing to this virus, it's a tragedy. And I just think it's horrific that somebody would laugh and mock them because they're dying.
Well, yeah, they're definitely hearing about it in response. Let's talk about what's actually happening right now, Doctor, and what we're really facing. And I think United Airlines might be a good example of it. They're down, I think, 3,000 employees out sick, none hospitalized, but they were all vaccinated. Do you think this is still a pandemic of the unvaccinated, as it's been called, or has Omicron changed that?
I don't think that's applicable at all. I think clearly, just looking at the numbers, I mean, you're just as likely to catch Omicron without being vaccinated as if you were vaccinated. It doesn't offer you any protection from catching the virus. But I go back to the original point that the vaccine was produced, and I think that this is a little bit confusing for people because when you think of a vaccine, you think of something that's designed to keep you from catching the virus, and the FDA and the CDC was very, very clear from the very beginning when they first started this under Operation Warp Speed that the goal of this vaccine was not to keep people from catching the virus, but to keep people from dying from the virus and or being hospitalized. Over time, those two things have gone down with the efficacy of the vaccine, But it is still pretty good at keeping you from dying and or being hospitalized. So your best chance of surviving this, if you are high risk, is to get vaccinated.
Because it does offer protection, right, Doctor? I mean,
correct.
Right.
Correct.
Okay. I want to just
clarify. And it just so happened that one of the side effects, if you will, of the vaccine originally was it also happened to keep you fairly well from catching the virus.
Right.
That has gone down dramatically, way more dramatically than anything else over time. And so now, again, if you're boosted, if you're vaccinated, it really doesn't matter. You're still just as likely to catch, or almost just as likely to catch COVID, but you're much less likely to die from it. So again, your best protection is still to get vaccinated and boosted, but it's not going to keep you from catching it.
Let's get you on the shortages that we're seeing. The HHS now saying that 1 in 4 hospitals report serious staffing issues. I know you're troubled by the response because in some cases, hospitals are telling the health workers to come back even if they are COVID positive and have symptoms.
Yes. So, that in and of itself makes sense. If the hospital was able to isolate and just have a COVID only ward where only COVID patients were, and it was a tent outside the hospital, totally isolated from everybody else, and you have COVID, but you don't necessarily have any symptoms or you have very mild symptoms as a healthcare provider, there's really no reason you can't go in there and help these people. So that part makes sense. But the problem is what's being implemented is they're telling people if you can go back to work immediately, and they're going in the main entrance of the hospital. They're going to the same coffee shops as everybody else. They're using the same restrooms as everybody else. So I can guarantee you that they're spreading COVID. But at the same time that they're telling hospital workers, come back to work, even though you have COVID, they're firing people who are hospital workers who don't get vaccinated. And there's lots of reasons why people might not get vaccinated.
Right.
The mainstream media and a lot of people are making people out to be psychos if they choose not to get vaccinated, but that's not always the case. If people just had COVID, there's really no reason that they need to get vaccinated on top of that, because their natural immunity trumps the vaccine-induced immunity. So why are we laying off hospital workers, but yet telling people who we know have COVID and are sick to come to work? It makes zero sense. It's absurd.
Yeah, Dr. Ron Elfenbein, emergency room physician, owner of FirstCall Medical Center. Thanks for the time tonight, doctor.
Thank you.
Thank you for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.